Hi, I'm Dr. Rudy Cashman, neurosurgeon, Fort Wayne, Indiana, for 42 years, but I'm only 39 years old. No, all kidding aside. I've been writing a series of lectures really on wellness. You can call me Dr. Wellness. You can call me Dr. Second Opinion. And tonight we have a very interesting subject. It's about cancer prevention. I'm firmly convinced, my own experience, reviewing the literature, that probably 50% of cancers can be prevented by proper diet, by exercise, by stress reduction, and participating in early diagnosis and prevention, getting mammograms and blood tests and things of this nature, get everything that medicine recommends. I think the cancer rate could easily be cut in half. Many patients are not aware that diet could reduce the breast cancer rate about 30 or 40% in prostate cancer. So follow me in this little adventure. It may be very important in your life. The first thing I'll discuss a little bit is about eating, preventing cancer, and also if you have cancer, what you should be eating at that point to improve your chances of survival, because survival rates are quite high in the treatment of cancer, but you must participate in this process. You must be part of this process. So knowledge really is critical. I'm going to give you some knowledge today. I wrote a book called The Secret of the Non-Diet. It's a way of eating nutrient-dense foods based on Dean Ornish and Esselstyn and Dr. Furman and Dr. Bernard, very well-known people, all based on medical literature. And it's a great way to have a perfect figure, to look good to begin with, but the diet is good preventing diabetes and cancer and heart disease, vascular disease. It's not that you have to restrict the amount that you eat. You got to eat different food. That's the point. So let's go through this, what I mean about this a little bit. A nutrient-dense diet. And I'll put up my food pyramid here in a little while so you can really look at it. Nutrient density means full of vitamins, full of minerals, full of phytochemicals, getting generally away from fat and meat and animal products. That's really what it's all about. So it's eating complex carbohydrates, okay? That's carbohydrates still with the coverings on them. For example, baked potato and carrots and broccoli, and 100% whole grain. When you're reading labels, it's got to be 100%. It can't be 2 grain, 3 grain, 100% whole grain, things still with their coverings on them. So they haven't been stripped of their nutrients, vitamins, and minerals, and phytochemicals that are good for you. White rice wouldn't be whole grain, okay? Rice still with its coverings. Brown rice would be whole grain, for example. And vegetables, beans, legumes, and fruit, all you can eat. They will naturally turn your appetite down. You don't have to worry about overeating generally. If you do that, you can't eat, 10 pieces of bread, obviously, but a couple of pieces. But in general, in summary, if you eat complex carbohydrates, you try to be 50% or less on the glycemic index. The glycemic index is 0 to 100. White bread would be 100. Beans would be 30. So you have to learn about the glycemic index a little bit, and you can go on their website, glycemicindex.com, and learn about them, and eat 50% or less on the glycemic index of whole grains. And incidentally, if you eat fat, 97% will sit in your belly or your buttocks in 4 hours. 97% of it. Only 3% use of metabolism. It is very difficult to convert complex carbohydrates to fat. Very difficult for humans. Animals do it quite easily. You can fatten up a cow real easily. They'll convert to fat quite easily. But humans can't do that. So just to cut fat out of your diet is a healthy diet in itself. So, but of these products I mentioned, eat all you can eat. You're not going to gain weight. In a very good diet for preventing cancer. Remember what I said? 40% of breast cancer due to obesity. Most women I speak to do not know that. It's not been taught to them. And then add some omega-3 and some vitamin D. Let's look at food a little bit. What are the toxins in food? Fat cells are full of cancer chemicals, about 20 of them. About 20 of those that cause cancer and dementia and vascular disease and diabetes. So to avoid animal products, which are full of fat, even chicken's not a health food. It's like Dr. Furman would say, it's like eating a donut. Where are the foods of color? Where are the phytochemicals in them? You don't see them. So animal meat is full of cancer chemicals, GFI, growth hormones, to reduce the cancer rate, avoid animal products. That's a big one. Increased rates of breast cancer, colon cancer, ovarian cancer, and prostate cancer with animal products. If you eat a nutrient-dense diet, say 80-90% of the time, the way I've described, you can avoid these cancers. 80%. Now, this is something interesting. 80% of uterine cancers, cancer uterus, is due to obesity. Something I just learned recently. It's in the medical literature. It was told to me by an OBGYN oncologist here at Lutheran Hospital. I happened to see in the elevator, and I was going to invite her to be part of this program. And she mentioned uterine cancer. 80% of uterine cancer is due to obesity. So, I mean, that's a really message for women here, and should be emphasized a lot more. Most women I speak to have no idea that with obesity, being overweight essentially doubles their cancer risk. And 40% of breast cancer due to obesity. So all this research looking for this rare thing at IU to give all the money to them to do research on a rare gene for which they've had really almost no results. When we could cure 40% of breast cancer by eating the right food, what do you think we should be doing? What should we be emphasizing to women? Besides making them look beautiful and avoiding diabetes and heart disease, but we could cut their cancer rates in half. We should be screaming it from the rooftops. Very important thing. What are superfoods? For example, onions and mushrooms. If a woman eats a good slice of a fresh mushroom, not totally fresh, eat it raw, put a slice of tomato on it, and say, put a small mushroom on top, that alone would cut their breast cancer rate 30 to 40%. A woman should eat that daily. So onions and mushrooms are superfoods because they're full of phytochemicals. Remember I said 25,000 phytochemicals in food. Although mushrooms and onions have no color to them, contrary to the other ones we recommend, they're full of phytochemicals. A strawberry's got 700 phytochemicals. An apple has 500. Superfood would be greens. Greens be number one, mushrooms and onions would be number two. Pomegranates, berries, and seeds are absolutely superfoods. Tomatoes and strawberries are full of phytochemicals. Now, how do cancers form? It's methylation of our DNA. Damage. What causes it? Smoking, for example, causes methylation. Eating toxic foods causes methylation. That's the way you form cancer. Like if you're a smoker and you develop lung cancer, which I see commonly because it spreads to the brain. Probably every third day I see somebody with it. They will have this methylation 20, 25 years earlier, many of them. They may even stop smoking, and then they develop cancer later on. I see it all the time. And methylation really is one carbon atom and 3 hydrogen atoms. That's the methyl molecule. So prevention is very important. And you'll hear the term epigenetic methylation to cancer. These are genetic changes that occurred many years ago based on what you're eating, whether you're exercising or not. So more greens, less methylation, less cancer. Less greens, increased methylation, increased cancer. Just to talk about chemistry a little bit. And now we're speaking about cruciferous vegetables, which my food pyramid are the disease fighters. They're the big ones at the very bottom. And there's the food pyramid right there at the bottom. The broccoli and the cauliflower and the peppers and the cabbages and the rutabagas there on the bottom. Cruciferous vegetables, they are the healthiest anti-cancer foods. And examples, they decrease cancer rates 40%, if you make them 20% of your diet, they reduce your cancer rate about 40%. Examples would be kale and cabbage and broccoli and cauliflower and turnips. What are the specific chemicals? I'll just give you a few examples. ITCs, the isocyanates, about 120 of them. They are degradation products of these foods and have been shown to exhibit chemopreventive activity. They are the anti-cancer phytochemicals. And that's the reason it's the phenols, the carotenes, the ITCs, the sulfones that prevent cancer. These are the phytochemicals. In general, we don't pay enough attention to them. And the ITCs, 120 of them, they remove carcinogens and kill cancer cells. The antioxidant, you hear the term antioxidation, anti-inflammatory, and they inhibit angiogenesis. What's angiogenesis? Tumors have to have blood vessels to make them grow. So cancer cells cancer foods, for example, will cause angiogenesis. Smoking will cause angiogenesis. In other words, make the blood supply to the tumors. And we don't want that. And so life-saving mushrooms. Remember, we mentioned mushrooms are being a great anti-cancer for breast cancer, prostate cancer. They're the queens of superimmunity. They're the queens of superimmunity. And greens are the kings of superimmunity, okay? They prevent colds, they prevent cancer, they prevent vascular disease, they prevent autoimmune diseases. They increase the natural T killer cells in our white blood cells. That we form some cancer cells every day. Every human does. It's our immunity that destroys them. But if you have a bunch of bad habits, it doesn't destroy them all, and cancer starts growing. So they prevent DNA damage, your own genetic structure. They repair DNA damage. These cruciferous vegetables and these mushrooms, they repair DNA damage that has occurred, maybe from smoking, maybe from eating the wrong food. And they prevent angiogenesis from blood vessels to grow. They decrease breast cancer rates, 40-50%. They decrease your estrogen levels, and fat has in it a lot of estrogen. That's why women and men do get breast cancer too, have increased estrogen because of the fat on their body, and they have increased rates of breast cancer. And so it is even in puberty. In girls who are overweight, they will start their cycles earlier because there's estrogen in fat. And that starts a host of diseases, including cancers in teenagers. Yes. So onions and garlic are anti-cancer, anti-inflammatory, antioxidant. It's the sulfur in them. So eating onions raw, garlic raw, is really great. Chopped, crushed, and chewed is the best way to really take them. And they detoxify carcinogens. If you eat a lot of those, 50% decrease colon cancer, 73% decrease ovarian cancer, 88% decrease esophageal cancer, one of the worst, can't swallow. 71% decrease prostate cancer, 50% decrease stomach cancer. Does that tell you something? I think this tells us something. Prevention is extremely important. Specific foods that are full of phytochemicals will be raspberries, strawberries, cherries, lemons. The chemicals in there are called limonene. Cranberries have phenols in them. Watermelon has lycopenes in them. Carrots have carotene in them. Strawberries, 700 phytochemicals. I eat a strawberry every day because I helped design the what we eat at Lutheran Hospital in the little lounge that we eat lunch every day. I helped design that. I know the dietitian in there. And I eat strawberries every day. I eat some nuts every day. Very healthy. Apples have 500 phytochemicals. There are apples there every day. I want you to eat an apple a day. Prunes have phenols in them. These are the phytochemicals I keep on talking about. And if you eat a lot of animal products, what did I say? They have no phytochemicals. And they even have cancer factors, like cancer growth factors. So animal products are not your friend. Your habits affect your cancer rate, obviously. Are you a smoker? I mean, 20% of the people smoke. And the genetic changes start, 15 years before you get the cancer that killed you. And excessive alcohol consumption also has increased cancer rates, especially in the liver. And a stressful life increases the steroids and the amount of sugar and foods that you eat. Stress results in a pot belly because the steroids are secreted because you think a tiger is running at you, because most of us has chronic stress, the internet, the job, economic conditions. So we have stressful conditions. We started eating because food is a drug. Food is a drug. It's more addictive than narcotics. So be careful that if you're leading a stressful life, that you don't overeat. And a pot belly is a sign of a stressful person. Drug addiction results increase cancer rates because it affects the DNA and genetic structure of your body. Sedentary lifestyle results in increased cancer rate because you gain weight, become obese. We talked about the chemicals and the consumption of a lot of animal products. We have higher cancer rates. And pollution in the environment, the chemicals we take in through our environment, we have increased cancer rates. And the following things I'm going to discuss all affect your cancer rate. Exercise and cancer. Exercise affects your cancer rate because exercise causes you to secrete chemicals that are very good for you, and they reduce your appreciation of stress. So you feel better. You won't eat as much. You won't. And the endorphins from exercise make you feel better. We have increased cancer rates, less stress in our body. So people who exercise 65% live at least 5 years longer. If they develop cancer and they exercise regularly, they live at least 5 years longer if they have less stress in their life and exercise more. So exercise is important. And at least 50% of the deaths are related to lack of exercise, poor nutrition, and stress. So exercise is critical, even if you can after you develop cancer. And I always tell people who can, well, I'm too tired, I'm too worn out. Well, turn on the music and dance in your bedroom. I wasn't dancing with the stars, I'll be honest with you. Many a morning I dance in the bedroom with my cats and dogs while the wife is making breakfast. And I find it very relaxing. So if you have trouble exercising, try dancing in place. And it's good for you. Stress reducer too. In 1994, the U.S. Surgeon General said lack of physical exercise increases the cancer rate, especially for colon and breast cancer. So exercise is a good preventative. Besides, exercise decreases your fat, decreases cancer hormone. So exercise is very important. Especially endometrial cancer, 80% is caused by obesity, so exercise is important. Exercise reduces, and diet reduces the uterine cancer rate, the ovarian cancer rate, the breast cancer rate. Especially females need to be educated about this. I rarely meet a female that knows her diet affects her cancer rate. Rarely. It's almost unknown. I've talked to 200 oncology nurses last year who were in Fort Wayne for a conference. I was the main lecturer on mind-body medicine, and I asked them how many of them knew that obesity affects breast cancer. Not one of them raised their hand. I couldn't believe it. It's almost like it's a secret, and very important for females to know. So I rarely meet a woman who knows this. Probably us providers' fault. We need to scream it out there. We don't need to look for that rare drug at some university that isn't around that's going to cure our breast cancer. 50% cut in half. Exercise, proper eating, and getting your proper test. Remember, you need to get the proper preventative test too. I think that's very important. And so 40% of Americans develop cancer. 40% of Americans develop cancer. Only 14% of the people who exercise regularly get cancer. Probably related to the chemicals secreted, less obesity. They don't get the chemicals from the obesity. So it's a huge difference between people, and they need to know that. And exercise oxygenates your tissues, and that have a less of a cancer rate because cancer cells want to grow in an area where there's no oxygen. Yeah. They're anaerobic. So if you get a lot of oxygen in you from exercise, and cancer cells tend to die, okay? Cancer likes to grow in anaerobic tissues, lack of oxygen tissues. Also, exercise stabilizes your blood sugar levels. So remember, cancer is a sugar feeder. Cancer wants sugar, yeah. So if your sugar's under good control and you don't have diabetes, and you're eating the right foods, and you're eating low in the glycemic index, your sugar levels don't go up a great deal, you have less genetic damage, which results in cancer. So patients who exercise tolerate chemotherapy better, incidentally. And negativity is an abnormal and anoxic metabolic state. So is cancer, okay? And the mind-body connection is important. How does the brain affect the body? Through hormones, through neurotransmitters, the autonomic nervous system from the hypothalamus and the limbic system affects our body. So we have hormones, neurotransmitters, and neuropeptides. An example of a neuropeptide would be insulin or oxytocin. So our brain can speak to our body. Candace Pert wrote a famous book called Molecules of Motion, 1972, and she describes that in great detail. So our brain affects our body, but interestingly enough, our white cells also make the 250 neuropeptides, so our body can speak to our brain. So very stressed people destroy their immunity through stress. Because immunity, remember, is what you use to fight your cancer. So how you think is equally important as what you eat. So thinking is very important. So the mind is involved with cancer also. Every thought, conscious or unconscious, affects the physiology of your body. Remember, a lot of your thoughts are subconscious. And incidentally, your brain prefers to store stressful things, nasty things, things you're trying to forget. Your brain takes negativity, and it's like Velcro. It's like Velcro. It sticks to your brain much more than good things to happen to you. Your good memories, your brain buries a lot easier. Your bad memories, your subconscious mind buries a lot easier. And so you have to be careful because you can get depressed because your brain is storing all the bad stuff and it's not storing all the good memories that you have. So one acts like Velcro and the other one acts like Teflon. So it's a nice comparison. So every physiological reaction of the body affects the brain subconsciously or unconsciously, okay? And it's through neuropeptides and hormones and neurotransmitters, which are the proteins that jump between an axon and a dendrite that send the messages, in your nervous system. We have 700 trillion synapses. That's the area is called the synapse, and we have about 100 billion brain cells. Okay, so every thought affects your 60 trillion cells of your body. Okay, every one of your 60 trillion cells eavesdrops on your every thought. Yes, every one of your 60 trillion cells eavesdrops on your every thought. So how you think affects the metabolism of your body and your health tremendously. Not only what you eat, but how you think is critical. You can't be negative all the time. You have to be a more peaceful person to affect your health. Stressful people get a lot more cancer. Look at Christopher Reeve, for example. He dies, and his wife dies of lung cancer a year later. She didn't even smoke. Stress probably did that to her. Stress probably did that to her. So what is holistic medicine? What I am? I'm a holistic doctor. I'm a wellness doctor. I do 250 operations a year, but also I'm a holistic. But what is holistic medicine? That's considering the physiology of the human body, okay, to know that real well, to look at the physical aspect of your health, but look at the spiritual aspect of your health. What kind of a person are we dealing with? It's more important to know what kind of a person we're dealing with than the disease they have most of the time. So to walk in to an emergency room and they say, "What's the level of your pain?" "Oh, it's a 9. Instead of saying, "And what's going on in your life?" and sitting down and taking a history or getting a yellow pad and a pencil, you'd learn a lot more about what's really going on. And in holistic medicine, we consider the physiology, the physical aspect, the spiritual aspect. I want to know what's going on in your life. It'll affect how you think. It'll affect how you eat. It'll affect the disease process you have. And each person is unique. Everybody's different. That's the reason I'm practicing medicine at age 39. Every person I met today is different. And what a good time I had today. I just had a ball. Every person I met was different. And you can probe and what's going on in your life. You find out beautiful things about the people, no matter who they are. No matter who they are, I find interesting things, even in children. And you find out, and you can influence their lives by speaking to them and not just looking at their x-ray test. Each person should be part of the decision-making team. I try to involve the person. I try to involve the whole family in the decision-making process of what you have. And as a doctor living within all of us, Herb Benson said that from Harvard, and I agree. You have a cut. Your body knows how to heal it. If it ain't a huge thing, get a little stitches in there. The body knows. You can just watch it heal in the next few days, okay? So there is a doctor living within us, a guy that gets the immunity going and the healing process going, and we need to take advantage of that. And certainly some things you got to have done. You got to get operated on. You got to get this, that, and the other. But many times, tremendous self-healing qualities in the human body, and we need to take advantage of that. That's holistic medicine, the physiology, the physical, the spiritual. Each person is different. Each person should participate. You must participate in your health care. And I hate to tell you this, but it's in the literature and it's my experience. 70% of the people see a doctor don't want to participate in the health care. They just do what he says. You got to have this? They say, fine. They never say, what about a second opinion? What about, let me read about this. Let me look on the internet. Let me check with my friends. 70% will just do what he says. But holistic medicine doesn't agree with that. You got to participate in your health care. You must ask questions. You must sometimes get other opinions for certain things, and not just say, you're going to fuse my back, or we're going to do a heart operation, or we're going to do this, that, and the other. Without, hey, wait a minute. Let's think a minute. Is there some other method I could get well? Could the doctor within me heal me? Could I wait a couple of months, see if I couldn't get better? And the more famous a surgeon you go to, you're more likely you're going to just say what he says. I say be open-minded. You got to be open-minded. I've been doing this 42 years. Let me tell you. I recommend that. So we're talking about mind, body, mind. How does the brain speak to the body? How does the body speak to the brain? When we talked about neuropeptides, hormones secreted in the hypothalamus, that little organ above the pituitary gland, CRH, cortical-releasing hormone, thyroid-stimulating hormone, follicle-stimulating hormone goes to the ovaries, ACTH goes to the adrenal glands, stressful glands. So the brain can speak to the body through hormones, neuropeptides, the proteins that we talked about, CRH, TSH, FSH, and neurotransmitters that jump, acetylcholine, adrenaline. These are neurotransmitters. And hormones, estrogen, testosterone, neurotransmitters, acetylcholine, epinephrine. So our brain can speak to our body. We have to remember this. How we think is important. So it's not just diet to prevent cancer, it's our thought process that affects the cancer rate. And I formed a mind map of this, at the center, the survival rate and the different things that can influence you that. And here's a mind map, the mind map healing. I'm going to get well, okay? And we have discuss here different things to get all the necessary tests you got, to get some stress control. You got to have a will to live. LeShannon proved that people live twice as long if they're positive thinkers or have a purpose in their life. Plan something, do something. You got to have a purpose. I feel lucky, at age 39 here. I have a great purpose to get people well. I give lectures, get a TV show, CDs, DVDs, books. I feel so lucky. I feel I have a purpose. When I meet people without a purpose, usually I meet a sick person. You got to have a purpose. You're going to give longer. You get cancer, get a purpose. Decide you want to learn a new language. You want to get a new job, whatever. If you can, try to get a purpose. LeShannon proved that in a very good book to read. And he lived close to me in New York City, actually, and never met him. He lived long. I'm not even sure he's alive today, but he lived within 3 blocks of my house. And I lived by the Metropolitan Museum of Art. He had a lady with metastatic breast cancer. He took her to lunch once a month at the Metropolitan Museum of Art, and then would walk her to look at her art that he liked, that she enjoyed, for a half hour. He did it once a month for 5 years. Restudied her in 5 years. Her breast cancer spread all over her body, was gone. So how you think is important. One case doesn't prove a thing, but he studied over 500 people. And he proved you could live twice as long, and the spontaneous cure rate doubled. So how you think is important. You got to have a will to live, okay? You need proper nutrition. We talked about that. We talked about exercise. We're going down the mind list. I also recommend visualization. Visualize yourself getting well. Visualization is a language of the unconscious mind. If you want to lose weight, visualize you want to lose weight. 6 months down the line, this is how you want to look, more likely to happen. If I hit a tennis ball, I visualize a shot. But visualize your recovery. If you're a constant negative thinker and the doctor says you're going to be dead in 6 months, well, you'll be dead in 6 months. But if you start visualization and more positive thinking, the spontaneous cure rate and survival rate goes up. Not going to work in every case, but I had a case with a gentleman with a young guy, 35 years old, with a big tumor sitting near the size of a tennis ball. And I asked him to visualize a Pac-Man coming in, eating up the tumor, and him urinating it out 5 minutes, 3 times a day. That was in October. And I asked him to meet me on July 4th at Lake Wawasee because he was from Syracuse on the pier, and we'd have lunch together. Guess what? He shows up, holds up 3 bass he caught under my pier. I said, that's my property. And we ate it for lunch. But that's a true story. That ain't going to work for everybody. It sure as heck worked for him. So visualization is something I teach. And get the standard medical info. Have a caring. You need a caring doctor. And he can't be sitting all day telling you when you're going to die. He's got to give you a plan, the things that are going to try to make you well. And if he calls in the terminal people right off the bat on you, I realize that's acceptable, but I just don't agree with that. I think we should think positively about you. You're more likely to live longer, better, and occasional spontaneous cure might occur. And to me, that's very important. You need social support. Love of the family helps. I love it when the whole family comes in. They get a pencil and paper. They're taking notes, everything that I say, and I love it. I love people with a yellow pad and a pencil because with so many specialists, it's tough to keep track of what's going on. You need somebody to keep track. I call them coaches, little coaches. I love the yellow pad and pencil, or recording things, and to help you through a complex thing if you have cancer. So love of the family, social support, a minister, a priest. If I see a priest or a minister in the hospital, I ask them to say a prayer. We all hold hands, say a prayer. Prayer can result in healing. That's positive thinking, and people definitely do better when they have some spirituality. I highly recommend it. And I would get all the chemo, radiation, everything they recommend. But what I'm saying is just to add to your healing process, to follow the mind-body healing process of diet and exercise and relaxation and stress reduction and music, and to bring things into your life so that you live. You're much more likely to prevent cancer, for one thing, no less live longer. Candace Pert wrote this famous book, Molecules of Emotion, proving that how we think affects our body. Very good book to read, 1972. I recommend it highly. I actually know her. She went to Georgetown. I went to Georgetown. She is at Georgetown in university. And so we have an emotional body. And she's the one who described the opiate receptor sites. She discovered that the 70 trillion cells in our body have little receptors coming off of them. And the first one ever, drug ever that she demonstrated worked at these receptor sites. They're the key that unlock the door to the cell. So these receptors are in all our cells, okay? Even for insulin to put sugar into the cell, it has to hit these receptors. It unlocks the door to the cell to get sugar in there for oxygen to make us energy. So she's the first one to ever describe the opiate receptor, a receptor site of a dog. And she should have gotten the Nobel Prize, but her boss wanted it, and there was some mix-up. She never got it, but she should have gotten the Nobel Prize for that. And so the monocytes, the white cells in our blood, she showed in her book, in her research, also make the neuropeptides in the white cells, and they in turn can speak to our brain. So our brain speaks to our immunity, and our immunity speaks to our brain. So it's mind, body, mind. Psycho-PNI, psychoneuroimmunology, is a subject that's being researched right now, how our mind affects our body. Research is being carried out on this. The white cells, the monocytes, the T cells, the bone marrow, the spleen, the thymus, that make these, store these, and eliminate these, all these structures. So these white cells are really the Army, Navy, and Air Force of our body. They're our defense system. Your Army, Navy, Air Force can be influenced by your thoughts, positively
or negatively. You're a negative thinker, and they tell you you're going to die in 6 months. Well, you're going to die in 6 months. Very little doubt about it. The will to live is very important. Hutchinson wrote a great book on that, and it's very important. You got to have a will to live. So let's go back in the history of mining cancer a little bit. In the literature, 2,000 years, 1846, Dr. Walter Heil said the nature and treatment of cancer was very clear to him. Questioning its reality would have seemed a struggle against reason. So he was saying how we think can influence cancer. In 65, Dr. Claude Bernard said a human being must be considered a harmonious whole. Remember, I talked about holistic medicine. Today's medicine today is practiced largely, boom, like the head has been cut off the body, like Descartes proved wrote about in 1635. It still hasn't been attached to the body by many providers. We got to consider the whole body. It's connected. So in 1870, Paget said depression plays a vital role in cancer. When people that are more depressed have a much higher cancer rate. So if somebody dies, there's a divorce, a relative gets cancer, common. That's actually common. So you got to watch your depression because it affects the neurochemicals of your body. And remember, that can affect your genetic structure, your DNA in your genes. Cancer cells don't get killed by your white cells because you've been storing your white cells by your thought process. And that's been proven in animal studies, even at IU, that they even figure out how to check that in rats and mice, I think it was, how their mind, their thought process, optimistic versus pessimistic animals, by how they were treating them, shocking them or treating them nice, affected their white cells. Kind of interesting. So depression plays a vital role in cancer, as well as anxiety and hopelessness increase cancer growth. So how you think is very important. 1893, Snow, first statistical proof of increased rate of cancer in a group of 250 patients. Okay? In 156, there was recent severe stress, loss of a relative, divorce, or death. So again, the thought process is important. Patients with severe mental disease like schizophrenia, idiots or lunatics, have a lower cancer rate. They think less. They worry less. Their cancer rates are less. Interesting. Paranoids, people who think too much, have higher rates of cancer than normal people. Interesting. Isn't that interesting? And that's proof. Okay? The Symingtons, man and wife, published a lot of work in this area. And they studied many patients, and they 159 patients. And they discovered that the difference between positive and negative thinkers and the cancer rates that they have, and it's more. And they said it's more important to know what kind of a person has a disease than what disease the patient has. That's been my experience too. It's more important to know who you are, what's going on in your life, many times, than what's on the test. But the patient walks in, let me see your MRI, let me see your CT. Hey, wait a minute. Let's have a little conversation first. Let's find out who you are and what you are and what's going on in your life. Very important. So cancer patients live twice as long if they are taught mind-body medicine. LeShan speaking. 30 to 40% of cancers are cured by modern medicine. There's no reason to be so pessimistic then, okay? One dies and the other doesn't, although they have the same disease. How do you explain that? Patients must be taught mind-body medicine and live twice as long. They have a higher rate of spontaneous cure rates. I see very little evidence of that in most cancer centers. You know, they don't teach a lot of that, and they're not taught a lot of that. And sometimes a cancer just goes away. You have a patient with cancer all over, and they retest a month later, and it's all gone. And that's a lot of that's related to the placebo effect. What the patient believes. I had a patient with a horrible malignant tumor, the ones that usually die in 6 months. First thing he ever told him, he says, "I'm not going to die, Dr. Cashman." And you know what? He didn't. Unbelievable story. And then that's a placebo. Okay? Nocebo is negative speak. And my son is a neurosurgeon, and he was describing, he says, "Dad, you know, I think I know what you're talking about now." He had a young lady, 35 years old, 4 kids. She had a seizure. You got a brain scan, and it showed, not a big one. It was the size of a golf ball, but you could tell by the characteristic, that's a malignant tumor. Not 100%, but 98%. So he then he describes it to her, and she says, "How long you got to live?" She says, "Well, probably 6 months." Here's a lady, no husband, 4 kids, and that's what you're telling her. She started screaming. Never did stop screaming. Screamed all night. I don't blame her. If I was me, I'd have done the same. Next day, biopsies a darn thing that proves it 100%. Goes back in, tells her the same story. And it's truth. It was a truth. The next day, she was dead. Why is that? That's the voodoo effect, where you believe the tribe and the priests point a finger at you and they want you dead, and you believe it. That causes changes in the heart, pulmonary hypertension, fibrillary degeneration of the heart, and they die. That has been scientifically proven. That's the voodoo. Negative speak, or the extension of the placebo. How we use placebo as negative speak. These changes on your x-rays are related to what you got. Well, maybe it isn't. But if you believe it, you've been voodooed. Maybe it could result in unnecessary operation. It could result in unnecessary procedures because you believed what was there. But maybe that is not related. That's the nocebo, negative speak. It's huge in medicine, but it totally puzzles me why most providers never heard of it. Matter of fact, I never met a doctor that ever heard the term. But to me, it's not taught in medical school, but it's huge. How we speak to people is huge. What they believe is critical. Maybe it's not related. We're too scientific in medicine. We need to remember this is attached to the human body. The patients know it. Oh yeah, they know it. We're technicians. We're engineers. You got to be doctors. We got to think about this guy up there. Remember, thinking affects your immunology. The will to live, love, and I believe have great healing power. So we need positive and negative expectations. And cancer is a weak cell. It's a confused cell. It's a reject that doesn't have all the normal chemicals in it, and it's a reject. So cancer begins with a cell with incorrect genetic information, and daily we form some of those and we destroy them. But you're going to destroy a lot more if you're eating the right food and you're not smoking and you're not drinking a lot of alcohol and not having a lot of toxins in the environment. You're going to have a lot less abnormal cancer cells, so the cancer rates are going to go down. So, like I said, we have a few cancer cells every day. Our white cells kill them right away. We make billions of cells daily, so a mistake wouldn't be a surprise, would it? But malignant cells are weak and disorganized, so you can't give up when you're diagnosed with something. You need to eat the right food. You need to think straight. You need to exercise. You need to run the necessary tests and take the necessary treatments to prevent, cure, and treat. It's very important. You must participate in your health care. And so causes of cancer, carcinogenic substances. We're talking about nicotine, tar. Nicotine, cigarettes have in them probably 7,000 nasty chemicals. So to stop smoking is critical because you can get cancer of the mouth and you get the esophagus of the lung. I see it all the time. It spreads to the brain, to the adrenal glands, and I see it in young people. Smoking, you just got to stop. And you lose your immunity. Drugs can cause cancer, stress, depression, genetic predisposition. It can be in the family, too. Diet, obesity. 20%, and this slide here says 20% of cancer caused by diet is much higher than that. It approaches 40, 50%. And so breast, prostate, and colon especially affected by it. Japan, little cancer, although they were smoking. Yeah. It's when they started eating the nasty American food in Hawaii, the cancer rate went up. When they had California, it skyrocketed like the rest of us. So food, it does have a tremendous effect. And I didn't mean to say something nice about smoking. It's a nasty habit. Those chemicals, I saw a lady the other day, maybe 6 months ago or so, beautiful blonde, and she had a terrible pain in her tailbone, and it looked a little funny to me, so I didn't think it was a disc. I did get a scan. It was cancer eating the bone up. And then her husband walked in. She didn't smoke. She didn't smell a thing. Husband walked in, and he's reeked from nicotine. And I had a diagnosis right there, and I was unfortunately dead right. Metastatic cancer of the lung, and then the smoke came from her loving husband, right? I assure you. And she died within 6 months. He will never, ever meet a person as nice and beautiful as her again, I assure you. And he couldn't even walk down one flight of stairs for me to privately show him her x-rays of this horrible condition. So please, if you don't smoke and somebody in the family does, kick them out of the house. They smoke outside or move on, because they'll kill the children, they'll kill you, and it's very important you get that out of your life. So put cancer cells in humans, and they immediately destroyed. You put transplant cancer cells by coincidence, like a renal transplant. You didn't know there was some kidney cells in them. I mean, that's happened, and your body will destroy them immediately. But if that person is on steroids to prevent rejection, if that's accidentally done, the tumors will grow like anything, because they're on steroids, which reduce your immunity. And this has happened. And then they have to take the organ back out, and the metastatic cancer that grew matter of days in the chest because of a transplant with cancer in it melts away quickly. That's immunity at work. And so in stress and illness, there's a strong link. Cancer has much higher rates in stressed out individuals, and especially things like divorce and loss of job, many times, unfortunately, leads to cancer. So stress reduces immunity. And Dr. Hans Seeley from Toronto, a German like me, Hans, Rudy, Dr. Cashman, you're German. They don't call me Rudolf August Fritz Cashman Jr. for nothing. And but Hans Seeley in 1954 did a great deal of research on stress and cancer in animals. Matter of fact, he found it so conclusive that stress can cause cancer in animals. All animal research has been stopped because he proved it, linking cancer and stress. The proof is 100% certain. And it's the same in humans, And I already told you the story of Christopher Reeve, where his wife developed lung cancer, though she's not a smoker. And you can take a stress test of how stressful are you. There's the Holmes Rahe stress test. You can take it, and adds up. I also have one myself. If you read a book called Welcome to Your Mind Body, Amazon Books, I wrote it. I have a stress test in there, and you can find out what is my stress level. I think it might be important to know. We all have stress, but some get more than others, and others deal with it more than others. And so when life is too hectic and coping fails, illness is the unhappy result, including cancer. It happens a lot. Economic stress, and that's why cancer rates are higher among the poor. The high increased rate of eating the wrong food, increased rate of smoking, partly because they have more stress, economic stress, family stress, more smokers, more alcoholism. But this is all in partly due to the dopamine, the feel-good hormone in our body, which is improved by food. So you have higher rates of obesity among the economically deprived, the higher smoking rate because that dopamine is low and nicotine raises it, more alcohol because, again, it raises the dopamine. It's the same system in our brain, and narcotics raises it even more, and people are just trying to have a good day, just to feel good. They're not even looking for a craving. Stress is very important in the cancer research. Here's a picture of Dr. Hans, my German buddy, and he died many years ago, but a great research. He wrote 100 scientific papers, 100. I meant 1,000 scientific papers. He has the general adaptation syndrome that's related to stress that he studied in rats. So stress suppresses your immune system. Your Army, the Navy, the Air Force, the Marines go away. Because of stress, the steroids in your body, because CRH, made in the hypothalamus pituitary axis, goes to your adrenal gland, and that secretes steroids and cortisol, and reduce your immunity, destroy white cells, and the cancer rates go up. So what's a good definition of stress? I like this one the best. Inability to cope with perceived, real or imaginary, threats to our physical, emotional, and psychological well-being. That, to me, is the best definition of stress. Hans Seeley used non-specific response of the body to stress is the definition he used. But I think we need to consider the mind too. Inability to cope with perceived, what you perceive, real or imaginary. Remember what I said? Bad thoughts are more like Velcro. They stick to your brain a lot more than good thoughts. So negative thinking is a poor thing. It stores up in your brain to the point eventually your brain can't stand it and you become depressed. You got to watch that. Turn on the music. Go dancing. Laughter. A hug. Sports. All things that reduce stress. Very important. You know I'm busy than heck, but I exercise regularly. Tennis 3 nights a week, lift weights twice a week. And I was in Dancing with the Stars again this year. I love dancing. What a great thing to do. So as an individual, increased level of stress, increased susceptibility to illness. Chronic, that's long term, okay? Not acute stress causes suppression of the immune system. Acute stress is over quickly. The tiger runs at you, you either get out of the way or you don't, and it's over. But chronic stress, that works us all the time. Can't pay the bills, having problems in the family, have a poor job, no good neighbors, whatever. It's things that are stressing us. The internet, bad news all the time, and we're watching the TV. Turn the darn thing off. There ain't much good going on there. Turn on the movie of your family, of you, and of your life, instead of depending on other people's lives. Newspapers and TVs are full of bad news. I mean, there's certainly some great programs, but full of bad news. Don't get too involved with and take it too seriously what they're saying all the time. The good stuff that's occurring around us, like the patients' stories I listened to today, the beautiful stories that people are telling me. Chronic stress is loss of white cells, enlarged adrenal glands that sit above our kidneys, enlarged hearts, weight loss, death. That's the adaptation syndrome of Hans Seeley. Okay, Dr. LaShannon, we already spoke about him, the psychologist in New York, who said to develop a purpose in life is very important. So emotional factors have a tremendous effect on cancer rates. And patients, when he studied these cancer patients, he found that patients' youth was marked by feelings of isolation, despair, and intense interpersonal relationship. He found in the history of the cancer patients. That's LaShannon. And previous strong personal relationships removed, death, divorce, retirement, increased cancer rates. Despair was bottled up. The zest left their lives simply wanting to die, ready for death. Many patients, significant number of patients who developed cancer, gave up on life, and 3-6 months later, it's like they almost wished it on themselves. That's in the literature. Dr. LaShannon says 76% of 500 patients with cancer had a history of emotional problems of severe stress. Scientific studies. Only 10% of the control group without cancer had this pattern. And then mentions also many other studies proving the point. And Dr. Simonton published about the ranch hand. This farmer, husband died. She developed renal cancer. She then developed a relationship with the ranch hand and fell in love, and her cancer went away. Then the ranch hand stole all her money and ran away, and bang, cancer reappeared. Does one case prove anything? No, but these are common stories. And so 6 kids off to college, now what? The mother's sitting there, nothing to do. Got to have a purpose. You have to prepare for that. Don't just have your kids all of a sudden the house is empty, the husband's at work, and you're by yourself. You got to find something to do. You got to develop a purpose in life. Retirement, now what? I've seen many a time that people finish GM 40 years and they have their retirement party. And someone told me about somebody at Starbucks recently, and the guy dies during the retirement party. And so you got to have a plan. You got to have a purpose. What am I going to do the next day? Okay, and within a month, you got to have a purpose and decide what you're going to do. Not sit around, watch TV, and watch the ball game. That just isn't going to do it. And we got to have a purpose. Warren's book, The Purpose for Life, is a great book. First time I read it, I thought, geez, I didn't really like it. But now that I read about the purpose of Dr. LaShannon and stuff, I see the point. We got to have a purpose. People do better with a purpose. And so hopelessness and helplessness lead no control, result in death. And so it's important. the purposeful life. I talked about Rick Warren already and Dr. LaShanne, and in myself, my own life. I found that I have a purpose. I feel so lucky. I thank God for it. And so the power of positive thinking, books written by Norman Vincent Peale, great books to read, incidentally. I had a patient I cured of something, and he used to be the assistant minister of Norman Vincent Peale. You know what he did? All the books that Norman Vincent Peale ever read, signed by him and his wife, Ruth, he gave them to me as a present. Thank you. All I can say to that. I read them all 2 or 3 times. I made a PowerPoint on them, 600 points. By the power of, you can if you think you can, the power of positive thinking, visualization. That's all the works of Norman Vincent Peale. New York City, he was in a church there for many years, the Marble Church. If you ever in New York, go visit it. He attached a psychiatry institute to the church because most of the people he was dealing with had some form of psychology. We think, I mean, for Pete's sake. And he caught onto that, and he helped a lot of people. He's not alive today, but he's a wonderful individual. Read his books. Read his books. You can if you think you can. That's one of his books. I've read it a number of times. And so with cancer, an individual gains a new perspective on his or her problem. So for some people, it's a wake-up call. I'm going to change my life. I'm not going to work so hard anymore. And if you could, the new permission slip to act a bit differently, if you can. Not all of us could. You know what I mean? So new rules increase psychological energy and the hope and renewed desire to live. Read some of these books. Norman Vincent Peale books. Read my books. The Mind in Cancer, I wrote a book. Amazon Books, you can get it. And so a change in the psychological state as well as change in the physiological state. The Will to Live is a great book written by Arnold Schwarzenegger. He wrote it at the time that I was born. Well, I can't say the year, can I? And he also was in New York. Had an office not far from where I lived. And he has many stories in there about, and I already told you about my son's patient and the voodoo effect, but that's what he's writing about, very important stories. Our society, a lot of negative thinking by medical providers and patients. You have only 6 months to live. Cancer is synonymous with death. Not true. Not true. Dramatic effects of surgery and chemo, and if you eating the right diet, if you exercise, if you can, you're going to improve your results. How you think you're going to improve your results. Do some visualization techniques of a Pac-Man coming in, eating up your tumors and urinating them out. That's healing. So learning about imaging, meditation would be very good things. And only a good 75% of cancer patients survive, and another 25% live many years. So you must participate. You must have a positive expectancy. Cancer may be fatal. Your body defenses are mortal enemies of cancer. Okay, modern medicine cures many patients and participate in it fully. Although I want you to do mind-body medicine, I never said don't participate in the scientific method. No way. Do it all, whatever your doctor recommends. But if that doctor never considers your mind, you might think of changing if you can. I mean, marriage has only 50% success rate. Cancer is no different. So hope is very important in cancer survival. So thank you very much for listening to me tonight. What I'm saying is 50% of cancer can be prevented by proper eating, by exercise, by stress reduction, by participating in preventative tests, and then participating, if you do get it, participating in the treatment, in all aspects of the treatment. What you eat after you're diagnosed with cancer is very important. So I really appreciate you listening to me tonight, and you can probably get this DVD eventually at my website, Cashflow Mind Body, and you can find about 15 books on Amazon that I've written all about the mind and the body. And we have this show here every week, Tuesday nights, in January starting, I think, on Wednesday at 9. Right now it's Tuesday at 9. All about the mind and the body. Very important subject. I don't want you to ignore it. I don't want you to submit to a bad prognosis. And I want you to have a plan on how you can improve yourself. And even a lot of times increase your survival rate. And if for some reason it doesn't, you'll certainly have a lot more happier days. It's worked many times in my patients. thank you very much for participating in our show. Hope to see you at some other shows. God bless you. I love you all. Thank you very much for listening to me.